Good afternoon, and thank you for joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're glad to have you along with us. We're also happy to be joined this afternoon by the Medical Officer of Health at the Middlesex-London Health Unit, Dr. Mackie, and the Executive Vice President, Interim Chief Clinical Officer, and Chief Nursing Officer at London Health Sciences Centre, Carol Young-Ritchie. We also expect to be joined momentarily by London Mayor Ed Holder. Welcome this afternoon to the media in attendance as well. And a reminder that if you'd like to ask any questions, just click on the question mark inside the text bubble here on Microsoft Teams. And when you do, if you could indicate your name as well as your media outlet and who your question is for. And we already have several questions in the queue, but as you know, don't wait till the very end to get those questions in. And finally, a welcome to those who are tuning in this afternoon on Rogers Television, as well as the Rogers Facebook page and YouTube channel, listeners on Global News Radio, 980 CFPL, and those who are watching on the CTV London website. Let's get to our opening remarks, and we'll start today with Medical Officer of Health, Dr. Mackie.
Thanks very much, Dan. So the great news today is we had our first zero day since last summer. It's been almost a year since we've had zero cases reported in a single day, and that's something tremendous to celebrate. It is, however, on the background of gradually increasing cases locally and provincially. So, of course, we're going to celebrate this accomplishment and also prepare for what is next. We are continuing to see growth here provincially, nationally, and really around the world as societies and economies reopen. We are starting to see Delta variant in particular spreading more. Fortunately, except in certain circumstances, we have not yet seen deaths, hospitalities, ICU increase substantially. I know we'll hear more on that from Carol Young-Ritchie in a moment. It looks like the current Step 3 public health measures will be in place for some time. Provincially, we're still off the vaccine targets. We've hit the 80% first dose, but we're not close yet to the 75% second dose. And from what we're understanding locally, the province is sticking to that criteria at this point. And so it won't be August 6th that we see any further reopening occur. I think that's where I'd like to pause there for now, Dan. Happy to take any questions when the time is right, but for now I'll pass to Carol Young-Ritchie.
And thanks, Chris. Good afternoon, everyone, and thanks for having me here today to provide an update on the COVID situation at London Health Sciences Centre. We are continuing to the trend of seeing low but consistent COVID-19 related hospitalizations. As of this morning, we are caring for 8 COVID-19 positive inpatients, and fewer of 5 of those being in our critical care units. We currently have 1 active outbreak on B7-200, and that's our adult inpatient mental health unit at Victoria Hospital. We believe we've contained the outbreak with a total of fewer than 5 cases there. As of this morning, 7 a.m., we have an overall occupancy of 92.6%. Our critical care capacity at University Hospital is 85% and 81% at Victoria Hospital. I'm sharing these numbers to provide a snapshot of our activity as we care for non-COVID-19 needs of our community while maintaining enough capacity to respond to the needs of the pandemic. Lastly, I'd like to encourage everyone to get vaccinated and continue to follow the public health guidance, including hand washing, masking, and physical distancing. Thank you.
Thank you very much, Carol. And we are happy to be joined by London Mayor Ed Holder. And Mayor Holder, I'm wondering if you would have some opening remarks that you would like to share with folks this afternoon. Mayor Holder. Just on mute there, sir.
How does that sound to you now?
You're all set.
Thanks very much, Dan, and good afternoon, everyone. You know, we just had our first significant external event with RibFest, which was preceded by the London Majors home opener and subsequent games since. And the reason I share that is because in Step 3, what you're now starting to see is truly an opening of our community events and our public events. We saw it with some external patio band music through Jones Entertainment as well. But all these things are an indication of the potential of things to come. And I want to share with the public that I was at the airport today for a federal announcement in support of our international airport. And the other thing that became obvious is that the requirement for people to travel will be predicated on people having their double shots. And to some extent, that may be part of the catalyst that will drive individuals to get their shots. But I've now come to a pretty significant conclusion, at least in my mind, that there are two groups now that are left that haven't had their shots, knowing that we've had some 80% and a bit perhaps with their first shot and close to 70% with their second. So give or take within that margin. And so you ask yourself the question, how are we going to get to the other ultimately 20%? And I'm convinced we won't. What I'm convinced is that there will be a group of individuals that just aren't sure, that want to wait, that think that mixing Moderna and Pfizer is the potential for concern, which of course I think we've made it pretty clear it is not. But I'm going to ask for patience, something I don't have a lot of in this circumstance. I can ask for patience from individuals who have had their double shots, because I fear there is going to be significant unrest, not with the unvaccinated getting cranky with the vaccinated, but quite the opposite. That vaccinated people saying, look, you're taking up our healthcare spots. You are impeding the progress of our economy from going forward. But I'm going to ask for tolerance and patience from those who have been given their 2 shots and taken their 2 shots. Focus not on the anti-vaxxers. It's a waste of time. They don't know any better. They don't want to know any better. It's where they are. And I'm not going to confront them anymore. It's not worth the time. It's not worth your time. I'm going to focus on those who can be educated, who are just looking for some assurances, who wait because they wait. And it's my hope that we will get into the 90%, if that's even potential. I can't tell you what that amount is, but let's just show some tolerance and kindness towards those who just need some reassurance, some education, and we'll get those folks shot. And the balance, I would love to worry about them, but there comes a point where you can't. And focus on those where changes can be made. So I just want to share that with you and thank our great folks that are taking care of us through the health unit, for our frontline staff, and just say as a Londoner how much we appreciate you, and how much, because of the work that you're doing, that we'll have more rib fests and more ball games and more external opportunities to enjoy. That's it for me, Dan. Thanks very much.
Well, thank you very much, Mayor Holder, Dr. Mackie, and Carol Young-Ritchie for your opening remarks. All right, let's get to the questions, and we do have a lot of them. The first, Dr. Mackie, is for you. It comes to us from Jennifer Beeman at the London Free Press. Dr. Mackie, the 30 to 34-year-olds and other young adults are still lagging behind in vaccine uptake. Is it because their vaccine eligibility started later? What is being done to bolster uptake in these age groups?
Sure. Thank you for the question, Jennifer. So definitely, I'm not sure if you recall, but we were moving through the vaccine cohorts by decade. Roughly every week we would open up to the new decade. And then the week we opened to this group, we opened to 2 decades, 22 years worth, actually, all the way from 18 up to age 40. And I think that kind of caught people off guard a bit. So that could be a factor. People weren't quite expecting it right there. We usually would get a huge bump in vaccinations in a certain population the first day or two. They would all rush to register. So I'm not sure if people were planning to register later and just missed that. The other factor, we know this is a population that has young children. That can be a pressure, and it's a population that hasn't been as affected as other age groups. If you look to the older age groups, you see more severe mortality and morbidity, people in hospital. If you look to the younger age groups, you saw more rapid spread in people in their late teens, early 20s. This population hasn't been hit as hard, at least in this region, by COVID. So that could be a factor as well. What are we doing? biggest strategy is making it as easy as possible for people, getting out into as many places in the community as possible. You know about the 12 vaccination pop-up mobile clinics where people can just walk in for first or second doses that are happening just in the next week, and many more in the following weeks. Getting close to people's home, close to places of business, close to where they might be, spending time with their family. We believe that will really reduce the barriers, and we're seeing that with our pop-up clinics. Lots of good first dose uptake there. So that's the main strategy, making sure that even as we scale our clinics back, that we still have evening hours, Saturday hours, Sunday hours available at the mass clinics for those that might be seeking those seeking those time slots for whatever works for them. We're also, and Dan can tell you more about this, but we've also got a campaign that is either in market or just about to be, where we're using creative marketing tools like coasters in the sorts of restaurants and facilities that we know cater to this age group, that give people a UPC code, sort of a link straight to a QR code right to our website, so they can know, when the nearest vaccine to them would be. So a few things we're doing to try and reach that group.
Thank you very much, Dr. Mackie. Yes, that will be actually coming out very, very shortly. So keep an eye out for that. Next question. This is another question for Dr. Mackie from Jennifer Beeman. We're at over 80% with at least one dose, and the rate of double dose people keeps rising quickly. Do you have a target for where you'd like to see the London area vaccination rate?
What we know with the Delta variant is that it really takes a higher vaccination rate in order to get anything close to herd immunity, and in fact, we may never get there. We're certainly happy to be past 80%, 81% as of Saturday in the data that we released today, and 68% second doses. And right now we're targeting 90%, and if and when we get to 90%, we're going to target higher than that. We're going to keep vaccinating until absolutely everybody who is willing to get vaccinated has the opportunity to get those first and second doses.
Thank you, Dr. Mackie. And one final question from Jennifer Beeman for you. How many people have been taking advantage of walk-in appointments at mass vaccination sites?
Yeah, we've had good uptake in the range of 15-20% of appointments. So across our whole system, that's hundreds of walk-in vaccination appointments every day. It's becoming a more and more important part of our campaign. We do have people that are booked, and calling them to try and rebook sooner is a big part of our process right now. But we're open all of those mass immunization clinics and all of the mobile and pop-up clinics for walk-in appointments.
Thank you very much, Dr. Mackie. Let's go to our next question, and it is for Carol Young-Ritchie, and it's from Jennifer Beeman at the London Free Press. Carol Young-Ritchie, what is LHSC's surgical backlog estimate from the pandemic, and what is its surgical capacity at now?
Yeah, our surgical backlog, it's about 6,000 cases. So we do have a lot of cases to catch up on. It'll likely take us some time to do that. I'm very happy to say we're back up to our normal summer grid of the cases that we do over the summer. So very happy to report on that. So that's pretty well about 12 out of our 15 ORs at University Hospital, and 14 out of our 17 at Victoria Hospital. So we are back up to our summer grid, and that's around between 400 and 450 cases a week. So we are catching up on those. And again, looking at all those cases that we weren't able to do during the pandemic and fitting those in as well, doing the highest priority cases first.
And a follow-up question for you, Carol, also from Jennifer Beeman. The province announced funding to help resolve the pandemic surgical backlog. Does LHSC have a plan for how it will surge above 100% surgical capacity in order to catch up? And when will this work ramp up?
Yeah, we've been working closely with government, looking at how we're going to ramp up our surgery, not only here, but across the system. So many of our hospitals in our region also So a number of things that are needed to do that. For LHSC, we need to look at our staff, the staff we have to ramp up that surgical volume. So things like having enough operating room nurses, that's a very specialized skill set. So looking at some training dollars for that, some of our equipment needs, and looking to maximize some of our space. As far as getting up to 100% or more, still working on our plans for that. How are we going to do that? Again, we know the pandemic has certainly taken a toll on hospital staff, and making sure that we're balancing all of that and addressing the backlog at the same time. So we're still working on those plans and working closely with government on that.
Thank you very much. Let's go to our next question. Dr. Mackie, this one is for you. It comes from Nick Paparella at CTV London. 0 new cases. First time since the vaccine rollout, you've been able to use those 3 words in a sentence, says Nick. Dr. Mackie, what do you chalk that up to? And is there concern that we may slide backwards like in some neighboring municipalities?
Yeah, I mean, 0 new cases. Very happy to say that again and again. It's definitely an accomplishment. No doubt part of that is because of low testing volume over the long weekend. There's no doubt, but the primary achievement there is really on the vaccine campaign and to every person in London and Middlesex who came down to get vaccinated.
Mayor Holder.
Well, thanks very much, Nick. I appreciate the question. Look, we're allowed to accept good news, and clearly this is very good news. Having said that, it's a moment in time. And while we are absolutely glad for this time, I'd also say that the big concern that I have is what will come beyond this. And I fear the 4th wave, the wave of the unvaccinated. And I fear that that's going to take hold and be significant. And, you know, when you imagine that's as much as 20% of our eligible population, tens of thousands of Londoners, I don't know what herd immunity means anymore. I mean, when you've got tens of thousands of people not vaccinated that could be, but I would suggest to you we're a long ways away from it. And so you ask about the concern that we might slide backwards. Relatively speaking to other neighboring municipalities, I'm less concerned about that, but sliding backwards, I am absolutely concerned. And I think it's real, which is again why we want to encourage those who are looking to who are looking for assurance, looking for education, just looking for encouragement from those of us who have had our shots. Those are the ones we want to direct all our attention to, so that we can potentially avoid much of the impact of the 4th wave, which I think is a matter of when, not if, and also to, I think, to limit the potential for sickness by virtue of having taken the 2-dose regimen that is so critical to better health. So I would say that's 0 new cases. Let's do it again. But that's kind of, it's something that's actually all within all our control. And it's ours to impact. And I hope that Londoners can feel good about this particular day, because it's a good day in London.
Thank you very much, Mayor Holder and Dr. Mackie. The next question comes from Colin Butler at CBC London. Dr. Mackie, what's your take on the province's back to school plan? Is it as thin as the critics are saying? It doesn't require teachers to be vaccinated, and what doesn't require teachers who would be working to be vaccinated, who would be working with children under the age of 12. Do you think that's wise?
Well, I mean, obviously there's a lot of thought that has gone into the provincial plan. There are some areas where the government has made, prioritization decisions. We know that if class sizes were smaller and the spaces were bigger, people's more spread out, that would help control the spread. That is very difficult given the school infrastructure that we have and the number of teachers available. And so the government's made a decision around whether that was worthwhile, and understand, that is the government's role to make those decisions. On the question of mandatory vaccines for teachers, this is, I think it's becoming more clear that this is an open question. You're seeing massive protests right now in response to vaccine mandates in France. And some of those protests, 200,000 people on Saturday, that suggests that they may actually be contributing to spread. So if you're going to mandate, it's absolutely got to be in a population that is very supportive. Vaccination rate in France is around 47%. It's not close to what it is here. So we have a lot more baseline support. But there is that risk that you generate some really unhealthy behaviors in response. So, I know the government has been working with teachers' unions, and I assume that they're making a decision informed by that work.
Thank you very much, Dr. Mackie. We only have a couple of questions left. So again, if you are a member of the media and you've been holding back on your questions, now would be the time to submit those. Jennifer Beeman from the London Free Press is back with another question for Dr. Mackie. Dr. Mackie, do case counts matter as much in this next phase of the pandemic, since vaccination has changed the risk of hospitalization and or death?
Well, the issue is that those cases are happening in the unvaccinated. And so in that sense, almost all the cases that we're counting right now have a similar risk of hospitalization or death as before the vaccine campaign. So there's no doubt that as we see cases rise through, you'll see hospitalization and death rise. It's just a question of to what extent they rise. And I mean, looking forward, the data is fairly consistent over the last couple of weeks that you're seeing a gradually increasing case count. There's no real reason to believe that would come under control anytime soon, right? In fact, we have more and more reopening. Vaccination rates are climbing, but they're not climbing as fast as those case counts. And as we go into the fall, we're going to see more indoor gathering. So it's quite possible that we'll see a significant second wave. And then the question to our members of the public are, do you want to get the vaccine or do you want to get COVID? The Delta variant is such an efficient spreader that it will likely infect at some point almost everyone who's not vaccinated. There is an outstanding question about third doses as well. The 2-dose regimen is very effective. The question isn't necessarily about boosters at this point. It's a question of whether certain subpopulations might need a third dose in order to generate the full immunity that most people would. Populations like people living in long-term care or people with specific medical conditions like organ transplant recipients who are under immune suppressing medication, they need a third dose in order to achieve adequate protection. Not talking about waning immunity here, I'm talking about adequate response to the first series. So that's a question as well. And then if we get into the fall and we're still seeing significant spread and we start to see evidence of spread among people who are already vaccinated, then you may see third doses becoming available to people who have had the first 2 doses. And then it really does become a question of whether you want full protection with 3-dose regimen or whether you want to get the virus itself.
And that becomes the choice, I think, as we move further along in the pandemic, get the vaccine or get COVID-19. Let's go to the next question, and this is our last one in the queue at this time this afternoon. And again, it's a follow-up from Jennifer Beeman for Dr. Mackie. Dr. Mackie, the province announced its return to school plan, allowing sports teams, musical instruments, field trips, and ditching masks outdoors. Jennifer's question is, does this strike the right balance?
Well, I think what is clear from the provincial plan is the government recognition of the importance of public education. I don't think anyone can look at the remote learning that we had over the past year and say this is good quality public education. It simply isn't. It's not adequate to support the long-term development, growth, and learning of our children. And so in the sense that the government is making a decision to have children in schools and doing activities that we know contribute to their learning, that is a huge positive. I'm a huge fan of healthcare as much as the next person, but it's education that is really at the core of our society's sustainability in the long term. If we fail on education, our society will not enter the next phase of human development from a good place. We know the knowledge economy is the leading economy coming in the next 50, 100 years. We have to be well positioned for that. We have to have good quality public education, and remote learning just doesn't do that. So that's a real positive. Obviously there are things like musical instruments. If you are using wind instruments indoors, it does present an additional risk. Whether that's the right balance, it's really a judgment call that only the government elected to reflect the values of the population can answer.
Thank you very much, Dr. Mackie, and as well, Mayor Holder. and Carol Young-Ritchie. That brings us to the end of our questions for this afternoon's virtual media briefing. And to thank you for being with us again on this Tuesday afternoon. We will be back with our next virtual media briefing on Thursday, the 5th of August at 2 p.m. and we hope you will join us then. Between now and Thursday afternoon, thank you so much for joining us. Have a great rest of your day, and so long for now.